she came in and she said how upset she was about the service being sold off. And she just looked at me and she said, "You know, you've saved my life more than once." And they weren't selling off beds, they were selling off people.
Today, we're going to hear from the people behind one of the biggest public health backflips in recent Tasmanian history. We're joined by Robbie Moore, the State Secretary of HACSU. Hi, Robbie.
Hi, Esther.
Alongside Paige, a mental health nurse, and Louise, a respite support worker, both from Tolosa
Hello,
Street.
Esther.
Robbie, could you give us a recap of exactly what was happening at Tolosa Street and what HACSU were fighting for?
Basically, the government announced a number of months ago that they were going to close the facility and move those services to the private sector. And this was of real concern to the staff. And straight away from the first day that I was speaking to those staff, they weren't concerned about their own jobs. They were concerned about the patients and the people that they treat day in, day out, and what it's going to mean for them. So from there, we've been running a really extensive campaign to stop this from happening and fighting for people with mental health conditions who need these services. And all along the way, the government have resisted that. It's been really disappointing, but fortunately, there was an announcement just a couple of days into the election campaign. I had a call from the Premier's Chief of Staff to tell us that they were backing down from this and that the services would remain.
And I think there was it was good for even myself to understand exactly what privatisation of our public services meant, which fewer beds, fewer staff, and also the ability to pick and choose the patients or consumers that they took in. What did you first think when you heard that the government wanted to privatise Tolosa Street?
Well, besides initially feeling upset, it was the injustice once again of how vulnerable in society that are just trodden on and just pushed aside, I think, to fit some, and it's all about fitting an economic picture, plugging a hole here. And what is also really, really frustrating with that hole plugging, it sometimes is for a very short period of time, and then it leaks badly. And added is a very, very real human face to it. There's a real human outcome to it. And we had to fight this on the grounds that it was something that we believed in what we delivered. We were fighting for our community. We were fighting for our consumers. And felt really good.
Yeah.
You're allowed to say that.
Yeah.
It wasn't about us. It
No.
wasn't about job security. It was about our communities and our people and what we deliver for them, and that at any time, anyone can be in that vulnerable position.
Well, speaking of which, one of your consumers, the gorgeous Grant, so courageous. He came and did a vodcast, and that's how passionately he felt about the services there, and also obviously clearly the staff. And I want to play a little bit of what he had to say and then get your thoughts on this. How does that make you feel?
Sad. I get so much out of this service. I'm not sure what will happen if it does close. So I've been accessing the Tolosa Street for quite. I've lost count how many years, and it means a lot for me to have it there, and also other people who do use the service. My mental health now is stable at the moment, and that's with the help of Tolosa. I've went there feeling like my mental health was really low, and I was getting my meds changed and that, and with the support of the staff there and that, it's helped me a lot. Please, Tasmanian government, please don't shut down this service. We all need it. It means a lot. Please.
So that's the cost, isn't it?
Yeah.
That is the cost.
That's exactly what it is about.
He spoke about not having private health.
Yep.
He was terrified. And I know, Louise, you're very close with Grant. How was that for you?
Oh, it was upsetting to see him so upset. He was feeling really vulnerable. He was concerned about his future mental health service, where he was going to turn to, how he said, "I'm going to be stuck at the Royal," and, nobody wants to be that sick that you have to be an inpatient at the Royal.
Well, they don't have the services, the proper
No.
services there for it, isn't it? Robbie, why do you think that Tolosa Street was targeted by the government?
Look, I think it was probably a cost-saving measure by the government, and it just proves that it doesn't care about people, and they've demonstrated that for the entire time they've been in government, in my view. And, to be trying to save money when this literally saves people's lives is just so unacceptable. This is a 12-bed facility that has delivered vital services to people, and I'm just so glad that things turned out the way they were, because if they hadn't, we would have lost people, and we also know that it would have impacted on the Royal Hobart Hospital that is already at crisis point, and that would have added to bed block and ambulance ramping and all of those sorts of things.
Louise, we spoke quite a few times off air, but also on vodcasts, and rightfully so, there was so much emotion when you spoke about this. What did it cost you in that time fighting
Um,
for that?
just this feeling of, I don't know what it is, that you can't fix it. Do you know what I mean? It's like you're doing all you can, like fighting, but you can't fix it, and you can't fix it alone. We had everyone, um, and we did fix it, and but it was just what it cost is sleep, time, anxiety, lots and lots of anxiety. Yeah, not just from like our clients were just so anxious about what was going to happen to them, and it breaks your heart, like you know. It does. A lady who comes in not often, and she doesn't come often, only when she really needs, and she got her letter to say we were closing down, and um, all the service was being sold off, and she came in, and we were having a chat after dinner, and she said how upset she was about the service being sold off, and she said, and she's not a big talker, and she just looked at me and she said, you've saved my life more than once, and oh. Yeah, yeah, just she knows we're there, you know, and that's what she needs. They weren't selling off beds; they were selling off people, and it's not on. Like you just can't do that.
Robbie, these are stories that you heard throughout the whole campaign. How did you feel when you found out about the privatisation? You hear these stories from your members.
Yeah, well, look, from the outset, when I first got to talk to the members, I was really just amazed at how they weren't worried about themselves. They were just so worried about the services, usually in these circumstances. And I think I'd be the same if I know my job was going, and that would be my priority, but it never was with these members. They're amazing people and the work they do. And certainly from the outset, we just thought this just makes no sense. We then learnt that the venue that was going to be used by the private provider had been bit by Housing Tasmania, and I think that showed that the government was getting close to being corrupt by getting health facilities paid for by Housing Tasmania when we've got a housing crisis and people living homeless. So this was as bad as any government decision I've seen. But it was the way the workers were able to get out there, tell their stories, as we're still hearing here today. They were always going to beat the government. And this was a test between listening to health workers or listening to the government, and who do you trust? And the people trusted these workers, and that's why they won this campaign.
And people showed up in
Yep.
droves, didn't they?
No, we did not realise that we had that support, to be honest. Didn't realise how far it had gone. So, yeah, thank you. Like, yeah, it was really, really humbling.
This service, and you're hearing it directly from Paige and Louise, but the reality is that this service is vital. It's delivered such good outcomes. We know that from just listening to one a second ago. So I just think it shows how out of touch this government was, but we've just got to make sure that nobody can try and do this anymore, because we heard that Tolosa Street was just the start of where they were going to go, and that other services such as Bilbrook Rise, were at risk. And hopefully the staff at Tolosa Street have not only saved their own service, but helped save services into the future.
Where were you both when you found out or you got that call?
I was at work and you called me.
Yeah. So Des called me, and he said, and I said, "Oh, hi, Des," and he said, "We won." I said, "What?" And he said, "We've won. And I said, "Won what?" And he said, "We've saved Tolosa." And I went, "What?" And it was bonkers. Yeah, I couldn't get it in. Yeah, and then I rang Paige at work, and she put me on speakerphone, and everyone come in, and yeah, it was crazy.
It was wonderful.
Des, who of course works here
How
at
dares you?
Yeah.
at HACSU and was really pivotal, wasn't he, in
Yeah.
that?
Very, very.
Oh,
Yeah.
yeah, amazing. Yeah.
And how about the consumers?
Well,
Uh,
and they felt relieved,
Mm.
didn't they?
Yeah, you
And,
could
and
see it. You could
relaxed
see it.
and
Yeah.
yeah. So I got a couple of phone calls saying, "Oh, well done,"
Yeah.
and you'll be seeing me again. We're like, can't wait.
Like winning lotto. It was, and I just felt this like a evaporation of anxiety and heaviness. It was bizarre how I felt. It was, light.
But
When you know you're right, you're bloody right, and
yeah,
that's the proof of it.
yeah,
There's no doubt in my mind that what you've done has saved lives. Just no doubt.
Yeah, I agree.
definitely.
Mm.
Yeah. Well, thank you for joining us.
Thank you.
Thank you, Robbie.
Yes. Thank you, Robbie.
Thank you.
Yeah, couldn't have done it without HACSU, that's for sure. Yeah.